play out from your point of view what's likely to happen today. As I understand it, we have Senator McCain coming back, rather dramatic given his diagnosis. He's going to come back and they're going to try to have a vote whether they're going to go forward on the Senate floor. What do you expect?
Well, I can just surmise that you wouldn't ask Senator McCain under these circumstances to travel 2,000 miles unless you had the votes. I assume he's the deciding vote, or it's somewhere close to that. So we will go forward with the debate. At least that's my conclusion this morning.
So what will you be debating? Because there are two different bills, as I understand it. One is just repeal, the other is repeal and replace. Which bill are you going to be debating?
Good question. Here we are in the United States Senate deliberating on the changes, basic fundamental changes to the healthcare system of America, affecting everyone. We're talking about 1/6 of the American economy, and I stand before you just hours before the vote, completely unaware of what this vote is about. We don't know what the Republicans are going to offer. They have not produced a bill. They have not had a hearing. We've not had any expert testimony. That, to me, does no service to the great institution, the United States Senate, for us to be in such a terrible position.
So there's a lot to question or even criticize about what's going on the Republican side, and but the president really wants to press forward. I'm going to play just 15 seconds here of what the president had to say about what's going on with health care.
The Senate is very close to the votes it needs to pass a replacement. The problem is we have zero help from the Democrats. They're obstructionists. That's all they are. That's all they're good at, is obstruction.
So, Senator Durbin, what about this accusation of obstruction? There was, as you know, a Washington Post ABC News poll came out a week ago now that said 52% of Americans basically think the Democrats only stand for being against Trump. What is the affirmative plan that the Democrats are putting forward?
Can I say at the outset, the Republicans have not approached us in the Senate, not a single one of us asking a Democrat to be part of a bipartisan discussion on the future of our health care system. They've done it in secret, they've done it behind closed doors, and exclusively among Republican members. So arguing that we're not cooperating, for goodness sakes, we haven't been invited to this party.